So the topic for this morning is complementary alternative medicine, and my aim is actually twofold. The first aim is an overview of that, which some of you probably are already aware of, but I just need to remind you about it. And the second aim, I hope, is to give you some skills which you can take home with you and you can apply in your day-to-day practice in medicine. That I think would be actually the better part of the talk, I hope. Okay, all right. Now, the topic assigned to me initially was alternative medicine. Alternative medicine means either or, no? While complementary means and, together with Western, Orthodox, or conventional medicine. Okay? So the term now that's most commonly employed is actually the Council on Complementary and Alternative Medicine, the PCCP. Now this covers a broad range of philosophies and approaches. Generally, these are not taught in medical school. They're generally not used in hospitals, and the insurance companies don't usually reimburse for the use of complementary alternative medicine. Holistic, the term refers to that you look at the overall, the totality and thought of the person, the psyche, the soma, the spirit, and the emotions as well, and even the social aspects of the person. When you speak of integrated medicine, it focuses on health and healing rather than disease and treatment. And we'll get to some important concepts, which I'm sure you're familiar with, but we need to be reminded of every now and then. Okay. When you speak of disease, it's something which happens to an organ, like you have a heart attack. Mr. So-and-so, the patient with a heart attack, in room ICU bed 5. Okay. Illness is what happens to Pedro who had the heart attack. Okay? It's a suffering which ensues or the meaning people give to that heart attack. Daming mga anecdotes, no? Okay, anecdotes. An anecdote would be meaning what we think happens to someone from a disease orientation, from a mechanistic orientation, may be different from what is perceived by the patient. No? Anecdote naman, the lowest level of evidence, chismis ito, no? Okay. There's this anecdote of this patient who thought he had throat cancer because of a conflict with his father. And once that conflict was resolved, nag-remit din yung cancer. Anecdote yun. But again, the importance of meaning as to what happened to that person. Pain is a distressing sensation. You palpate on the abdomen, you do the rebound, that's painful, right? Okay. But suffering is what it means for people to have that pain. They're of course different. No? Examples of that would be if you have a patient with a coronary artery disease. Our previous speaker talked about MI, and this patient undergoes sternal slitting and undergoes CABG at the Davao Doctors Hospital in Mindanao. And what happens is after post-op, the patient has chest pain, the patient suffers a lot and thinks that he has another heart attack. But it's actually chest pain. Okay? So the meaning is different from the actual sensation. Okay? If you have a patient, the most severe type of pain is diba? Giving birth, sabi nila. I wouldn't know because I haven't given birth, of course. It's like putting in it's like swallowing a watermelon whole. It's that bad. No? But basically, there's a lot of pain there, but there may yet be a lot of suffering because after the baby comes out, it's actually a beautiful experience for the mother. Alright? Salamat po. Ano yung sa pipili? Ay, salamat ni anak ko po, diba? Okay. So, pain and suffering are different things, no? For some, it may be mild pain, but the suffering is significant, and you have to address the suffering, otherwise the pain itself will not be controlled. We know this, but we need to be reminded. Okay. Now, other concepts are important. When you speak of treatment, it's what you do to people. No? You treat, you give this patient an antibiotic. Healing is something that is internal. Why do antibiotics work? Right? When you give an antibiotic in medicine, 3 things you think of in all types of infection. 1, the organism. Secondly, you think of the host defenses. And third, the right antibiotic, right? The organism, the right antibiotic, and the host defenses. No matter what you do, the best antibiotics for the right drug, it's sensitive, but if the host factors are down, the patient dies just the same, no? So, healing is actually more internal. It's what happens in spite of what we do sometimes, okay? When you speak of treatment, it's something you establish physically. This is the dimension. Physical healing involves the whole aspect of the person. Okay? Death, when I graduated from medical school, I think even in the medical school where I teach right now, there are not too many courses or emphasis on death and dying, which I think we should probably emphasize on medical students now. No? Well, when I had my first patient who died on me, I thought it was a failure on my part. Only, of course, to realize down the line that all of us are going to die. Diba? Okay? So in medicine, the orientation largely is that death is avoided at all costs. So until the last drop of blood kung pwede. And sometimes that's not a very nice thing to do. You may be actually prolonging suffering, not prolonging life anymore. And in speak of treatment, you have the blood pressure going down to 110/80, while healing is a path, is a way of being. It's like Buddhism, if you think of Buddhism as a way of life, but not a religion. Okay? So it's a way of becoming whole, becoming attuned with your physical, your mental, your social, your spiritual, and your emotional well-being. Okay? So sabi nga ng WHO, health is not merely a state, the absence of diseases or infirmity, but a state of complete physical, mental, social well-being. Sama mo rin dyan emotional at spiritual dimensions. Okay? So you can die, you can be healed and still die at the same time. Okay? So we don't forget. Now, if you look at the NIH, National Institutes of Health, they divide the complementary and alternative approaches to basically 5 domains. So the first one is alternative medical systems like Chinese medicine. They do autopsies at that time. They have their own system which revolves around yin and yang, which revolves around meridians, which revolves around the balance of the positive and the negative forces. You have Ayurvedic medicine, which divides bodies into different types, your Kapha type and the other body types. Homeopathy looks at and it's actually, some would say, it's energy medicine. And what they do is they dilute things, they treat like with like. If you have fever, they give you something which incites fever in large doses, but in a very, very, very minute dose that you do not find it anymore. So it's actually the energy of the compound, so they say, that works. No? And so there's this joke, you cannot die from overdose of homeopathic medicine because there's hardly any component in there. And then naturopathy looks at the combination of water, looks at the combination of herbs and the other things. So those are different medical systems which you can actually compare side by side with Western or conventional medicine. Iba ang paradigm completely. Okay, iba ang paradigm. Now, it's a different thing. No? It's like looking here and you look at, I'm looking outside that door, I see a car that's blue. If I look at the other side, what I see is something else. We're both right, but we're looking at it differently. So they're actually different medical systems altogether. Since they didn't, like say for example in China, since they didn't have autopsies, they would utilize pulse diagnosis. 32 different types of pulse that they've identified, and these 3 figures for that. And they also utilize tongue diagnosis for that. Okay? Alright. And the others. And there's some healers in Tibet, so I've been told that they just they meditate and they feel the person's pulse and they know what's going on inside the person's body. Now, biological-based therapies would be herbal, orthomolecular biological therapies like shark cartilage, say for example, can fit there. Chondroitin sulfate, which we now use for osteoarthritis as well. Herbal, we know that megavitamins may also fit in this category.